Hi, it's Brain Bites with me, Dr. B. I'm Jess Beachkowski, your friendly online psychiatrist. Today I'm talking a little bit about psychedelics and neuroplasticity, especially as related to treating PTSD. Let's dig in. So, neuroplasticity is one of the really important concepts here. So, the greatest period of neuroplasticity is during the developmental years. So, of course, that prior to 25 years old piece, the neuroplasticity is really high. So, an impact of trauma on someone very young can really impact that in a negative way. Or potentially they can overcome it if they get the treatment that they need or the support that they need. They can move past that a little bit easier. So I'll talk about this a little bit later on, but that's some of the reasoning behind using some of the psychedelics, some of the new treatments that are coming out is to increase the neuroplasticity, and that may be part of the reason that people can have really great results with just a few treatments with some of these psychedelics. So the idea is that it increases the neuroplasticity because that's what you have when you're younger and you're learning new things. So you experience something and you learn how to deal with that in your environment. I want to talk just briefly about ketamine and PTSD treatment. So, ketamine we know was used initially for depression and also suicidality, but they found that it is also a great treatment for PTSD. Ketamine is an NMDA receptor antagonist, and we think that part of the reason it works is because it enhances plasticity in certain areas of the brain. So, mostly we're talking about the link between the amygdala and the prefrontal cortex. So, that decision about the fear conditioning. If we have increased plasticity, it opens the brain for more learning. And the idea is that we can have fear extinguishing from that experience. So the brain is ready to learn. Part of learning can be to extinguish a fear when it's well ingrained because you learn that that stimulus doesn't always cause this problem. So that's one of the theories behind how the ketamine is working. We tend to see improvement in depression with ketamine, but the response that patients have with PTSD, it's not due to the response in the depressive symptoms alone. So it does also help with the hyperarousal and the intrusiveness of the PTSD symptoms separate from anything related to depression. So there was a study published a couple years ago in 2021, and of the patients that they chose for that study, two-thirds of those patients responded to the ketamine treatment with at least a 30% reduction in their symptoms. So that's a pretty significant treatment response. I would say that's better than a lot of what I get with patients with SSRIs. So ketamine is considered to be really well tolerated. It doesn't seem to make any patients that have problems with dissociative PTSD, it doesn't seem to make the dissociation worse. Mild dissociation is something that they can experience during the treatment, but it has not seemed to worsen any of the symptoms after the fact. So we still don't really know exactly how ketamine is working, but right now we're working with that neuroplasticity idea that that's what's helping facilitate the learning so that patients can discern when something is actually a threat versus no longer a threat. One of the interesting things that they're looking into right now is whether or not there are certain psychotherapies that can benefit from ketamine as part of the treatment. So, is there a benefit to providing ketamine infusion and doing prolonged exposure therapy or cognitive processing therapy in relation to those ketamine treatments? Will you have a better response if you apply those together? The goal with that would be that there would be a longer term response. If you were able to have more plasticity in the brain, you were able to have more openness to learning, then you applied the therapy in association with that, and you were able to learn more, that you would recover from the PTSD in a way that would be longer lasting than if you just had the experience of the ketamine without the extra learning piece that they gained from the psychotherapy. And then one other caveat with ketamine, it can be a drug of abuse. And most of the studies that I saw hadn't looked at a substance use population. So it's unclear if there are any risks to taking someone who has a comorbid substance use disorder and giving them ketamine as a treatment. So I also want to talk a little bit about MDMA treatment for PTSD. This is therapist assisted treatment and it's currently being investigated in phase 3 trials. There was some possibility that it will still be approved before the end of the year or possibly the beginning of next year. So, with this specific treatment, the patients get an infusion of MDMA over 8 hours with two therapists present for the entire session. The patients have a music playlist and they are given an eye mask to go inward and make a focused internal experience, and the therapists are present for the entire duration and provide non directive support. So there are generally 3 sessions before the first infusion and then 3 sessions in between each infusion. The studies that I looked like, I think there were 3 infusions. So it was at least 40 hours worth of therapy for each patient. And there were 2 therapists present for the whole time, every time, one male and one female. So that was the way the studies have been conducted, and that's what we've been looking at for hopeful FDA approval in the coming months. So MDMA is an amphetamine that also has some mescaline-like properties, so it can cause some mild dissociation and some consciousness altering effects. So again, with this medication, kind of like with the ketamine, a lot of what we're looking at is neuroplasticity. We think this has a big impact on neuroplasticity. It also plays a part with the monoamine transport system, so serotonin, dopamine, norepinephrine, and also oxytocin, so some of that prosocial stuff as well. So there are thoughts that the medication works because it helps with the social interactions, it builds trust and openness, and by having this medication infusion and having these therapists present, that they can work through the fear, they can work through the re-experiencing without the same physiologic responses. They're more open to discussing or experiencing the memories of what happened and that they can better consolidate and work through that. There's also some thoughts that it impacts the learning, again, between the amygdala and the prefrontal cortex. So again, that same circuit in trying to work on the fear extinguishing so that the brain can learn that this doesn't have to happen every time. We don't have to avoid all these things. The situation is benign and it's not actually a dangerous situation like we keep thinking it is because of the signals that we're getting. Those are some interesting pieces about how the MDMA may work. These are theories, of course, we're not really sure, but this is what we're thinking is causing these great responses in patients that get this treatment. So therapy is hard for a lot of these patients. If by getting this MDMA treatment, it helps to build that trust and openness, it may make the psychotherapy a lot more effective, where before it was getting in the way because they couldn't have that social interaction with the therapist to have those good benefits from the treatment. And then finally, it seems like the MDMA treatments are relatively safe. There were some transient increases in heart rate and blood pressure in some patients. Cardiac may be something that we have to monitor for if this becomes a mainstream treatment, but there were no documented really significant adverse side effects. So there are some concerns about deliverability of this sort of treatment. This is not something that's going to be really easy to get insurance to cover. Not sure about all of that. I do have a stat here. According to one of the analyses I read about, MDMA-assisted therapy breaks even with standard of care at 3.8 years, which is still pretty reasonable, I think, since I see some of these patients for many, many more than 3.8 years. But it is something to keep in mind. The studies that have been done are not on a diverse population. They are on a very select patient population. So as with any time there's new treatments being approved, it's hard to extrapolate right away how anybody might respond to this treatment without having all that extra information. So it's going to be a little while until we have more to go on and how to figure out how to refer patients or who's going to be likely to respond to treatment. But this stuff is fascinating. I mean, it is absolutely fascinating. So the fact that we might have access to treatments here in the next few months that could give us more information about what the process is and what's happening to create these great results may give us other directions that we can can go in that might have, faster results, less time consuming or less cost prohibitive ways to get the same results. So hopefully you found some of this interesting. And even if you can't give anybody MDMA right now, this does provide an overview of what's to come so we can all be excited about the future treatment of PTSD. Well, I hope your brain is full of psychedelic goodness. No mushrooms required. Be sure to enjoy more tasty tidbits at brainbiteswithdrb.com. Enjoy!